Hey guys, and welcome back to another episode of Surviving Out of Spite. My name is Samantha Sauer, and I'm your host. Living with chronic gut issues often means endless symptoms, countless appointments, and far too many moments of not being heard. In this episode, ER doctor and new member of our medical advisory board, Rick Pescatore, helps us unpack the challenges of treating gut health in emergency medicine, the importance of truly understanding the patient experience, and how digital solutions like BellyMD may empower patients to take control of their health story. Stay tuned. All right. Good?
Good.
Okay. All right. Well, hi, Rick. Thank you for being here with me today. Really great to have you on. I will give you a chance to introduce yourself for those out there who don't know who you are yet.
Well, I appreciate it. Thanks very much for having me on. I am Rick Pescatore. I'm an ER doctor by trade. I've jumped around a little bit in medicine, had the opportunity to serve in public health during the pandemic, went back to the bedside after everything. And, one of the things that I've encountered is that everybody really seems to be pretty sick. And that's where I anchor. I anchor in the emergency department, and we just see this increasing rate of patients coming in with what we now know to be disorders of gut-brain interaction, and that's what brought us together.
Yeah, I remember getting your email, and I'm like, who is this? Like, what is he talking about? Is this as good as I think it could be, with how you were describing everything you were building? And I'm very happy to say that it is everything that I thought it was going to be and more. You're, on social media talking a lot about like the patient experience and your physician experience in the ER and treating patients, especially with gut issues and things like that, and what you're building kind of led you to that, which I think is incredible.
Well, that's very kind of you to say, and that's really it. I sit in the ER. We've sat in the ER. I've been an emergency doctor for many years, and I think, first glance, wouldn't expect an emergency doctor to spend much time in patients with chronic abdominal pain, nausea, vomiting. But very much, my mentor in emergency medicine, a guy by the name of Jim Roberts, who literally wrote the book. It's called Roberts and Hedges for Emergency Medicine. And, he talked to me about how they built the field of emergency medicine to catch the people who were falling between the cracks. And, way back then, that was different. That was gunshots, heart attacks, strokes. And nowadays, they don't really fall through the cracks so much. There are different people falling through the cracks, and we're catching them in the emergency department. But, frankly, we haven't done the best job for them in the ER.
Yeah, I know as somebody with chronic gut issues that when I have gone into the ER for something related to that, or I'm trying to explain what my issues are that are the chronic issues in the ER, it doesn't always go over that well. You get a lot of questions of, well, are you sure you have that? Or, what else is there? Is it anxiety? I'm like...
Yeah.
Well, it is now, because now I'm afraid you're not going to treat me. So.
Well, that's for sure. And we see these patterns again and again in medicine, this dismissal in the absence of evidence. And, I can go on forever and ever about how this is indicative of broader failures within the culture of medicine and how we've become hyper-specialized for a lot of good, right? We know that trauma centers are good. Heart attack catheterization centers, those are good. But because of this hyper-specialization, those individuals with cross-cutting pathology, they get left out in the cold. And when that happens, we have a culture of medicine that is instilled to look for evidence-based endpoints. And when you have a group of individuals that everybody has cast to the side and hasn't bothered to find evidence-based endpoints for, well, then they come up with nothing for them.
Yeah, it's interesting just hearing from a physician and hearing you say all the things that, like, I've thought, right? But as a patient, when you start bringing those things up, depending on your audience, it can either be misinterpreted as like, oh, well, you're just not happy with the care that you're getting, or you didn't like this, or, all these excuses, or somebody just doesn't want their ego hurt, right? To say that like you're not giving me good care, and it's not necessarily about your ego, it's about the care for the patient, and just saying like we want to be heard, we want better care, we don't want to be afraid of the ER. Like I have said multiple times, like I have to be dying in order for somebody to have to take me to the ER. Unfortunately, I've been in situations where I've had to get dragged to the ER for whatever's going on. But when that's what that's supposed to be there for people, when you're in a situation that needs care right away and you're afraid to go because of your chronic issues, especially chronic GI issues, like, I don't know why more people don't realize that's a problem.
Yeah, it's fascinating because we have found ourselves at a unique moment in history, and one that, really requires a little bit of evaluation of where we've been. There's no question whatsoever that the broad populace, the greater population, has very distinct knowledge and interest in what's going on with the gut, with the belly. At the same time, we know that we have a population that's sicker than it's ever been, that there are
Yes.
subclinical deficiencies, and there are problems that are overarching and cross-cutting and that affect a large swath of the population. And then layer on top of that you have a group of physicians in the emergency department who for the past decade have been mired in the importance of evidence-based medicine. Emergency medicine as a specialty of medicine is a teenager, right? It was created in the 70s and, just is sort of trying to find its wings over the past few years. And the specialty has undergone a real come to Jesus moment when it comes to patients presenting to the emergency department with these chronic subclinical and overt symptoms. And, we are now at a moment. We have an opportunity to identify that we have come short in our services for these patients. We look at the lessons learned from the pandemic about the importance of providing our services, not just as acute care available list, but also as emergentologists, as individuals who are able to get to the root cause of what's causing a patient to decompensate and to intervene upon it. And so where do we land today? We land with nearly 50% of the population, 43% of the population, walks around every day with some degree of belly pain, nausea, vomiting, discomfort that they just shouldn't have to. And you have a group of physicians, emergency physicians, who have been ramshackle treating this group of patients for the past decade, but now we're ready to make significant change.
Yeah. Well, it's so great to hear that someone has started to identify this, right? That you're acknowledging that we're at a pivotal place where you can go in this direction or you can go in this direction, and we want to go in the direction that brings education to other physicians to continually help treat people, but also to acknowledge the patients that have been not acknowledged for so long, and why we're dealing with all of this. Why are patients feeling the way that they are? Why is everybody having this nausea, vomiting to some degree? Why is there such an uptick in these issues? And is there a commonality that maybe we're all missing? Is there that big puzzle piece that like connects all of us that we can sit there and have a light bulb moment and be like, I think I fixed it? Probably not, but a girl can dream.
Well,
But
I think that that's very much the question and the answer. In the moment we are in, we can now utilize artificial intelligence to solve many of those problems, and not the most obvious ones to begin with. The first problems that artificial intelligence can help us address are knowledge sharing and communication. We can use artificial intelligence to dial patients in on their pathology. We can use artificial intelligence to help doctors make sure they have the best information and the best ways to treat patients with the information available to us. And then at the same time, we can use artificial intelligence to grow our knowledge bases, to do exactly as you said, find the patterns within the pathology, look for the secret links between the phenotypes of presentation of patients with disorders of gut-brain interaction. And that's exactly what we've done and what we're doing at BellyMD. I'm super excited by it. We've really started with that AI machine learning algorithm and pointed it at patients who have very similar lived experience. That is, patients who show up in my emergency department puking their brains out, and we've got nothing for them. Nothing's wrong. It's just in your mind. These are patients who wake up every day with nausea, vomiting. It's just completely unexplained. You're running into the bathroom for no reason because of your bloating and your pain. We pointed our AI algorithm at them, and we looked for the patterns within how they talked about, how they described, how they felt things, and then we looked for the patterns within how they responded to things. And we're very excited. We've been able to uncover some really exciting therapeutic targets, some ways that we're going to be able to make significant differences for these patients.
It's amazing. Now, for someone like myself who I know where my nausea and vomiting comes from, right? Like I know that I have gastroparesis. I know my digestion is shit from, top to bottom. It does not work properly. So for someone like me who knows where that's coming from and it's not necessarily questionable, how can utilizing the technology that you're building and putting together help someone that has some of the puzzle pieces but maybe hasn't made connections either to other triggers or other diseases or something like that?
It's a good question, and this is where I really get proud of what my team has put together here. And the reason I'm so proud of it is that it rests in exactly what you're coming from, is that we all have commonality between us. There's always these nexuses and nidai of similarity between every single one of us. And believe it or not, nearly 3 decades ago, the NIH saw this coming. The National Institutes of Health saw that we could rest our data points, rest our understanding, not just in quantitative endpoints, numbers and p-values and alpha values, but also in qualitative endpoints, how people feel. And they built databases and treasure troves of understanding what it means to be nauseous compared to other people, what it means to not feel good. And then from there, we harness the magic of AI and machine learning to jump off that in a super fancy math equation, science, fantastic thing that puts your own equation together. It builds off of the single point of lived experience across the entire country and then builds its own algorithm built on your own nodes and edges. Now, they have to be qualified and valued. We are the ones that are sort of gate kept. Like, we don't allow that, you don't like the color orange. No, these are things that we look for as fundamental contributors to an overall marker of belly health. But what we do here is just so exciting. We let a fundamentally data-driven foundation, the NIH, the promise endpoints, just unassailable. We build upon it with modern day AI and advancements we've made in understanding the patient experience, and then we let the patient build it upon there on the magic of the machine learning algorithm.
That's so interesting. And, just to follow along with that, to really hear the entire process, of the identifying the issue, how to put that together, how to make that workable for patients. Like anybody that has an idea, that has the ability to build something, you can go build it, right? But it doesn't mean the application and how that great idea is, it doesn't necessarily mean it's going to work, right? So everything that you're describing has the patient experience and patient usage in mind, which means that the outcome of not only using the app and utilizing the knowledge helps the patient be able to convey their symptoms forward, understand their symptoms to maybe a higher degree that they weren't able to before, but also can help improve their outcome when they are able to explain it, show data, and share that with the physician to say, this is what's happening or this is what's going on. And it kind of, I don't want to say it makes it more believable, but having that data sometimes where, your labs look fine, so I don't know what to do with you. It's like, no, this is really what's going on. It gives some agency back to the patient. And that's really amazing.
That's exactly it. The agency back to the patient. We are handing the patient a biomarker, a validated digital biomarker that is rooted fundamentally in how they feel. And so no longer can you be gaslit into saying everything's normal. Because the biomarker, validated, is built on how you feel. And here's the thing, let me back it up from there. I don't want to masquerade as if simply having this information is going to be curative. I think it will be helpful. I think having a badge, having a sort of verified identifier of something that better represents your experience is important. We at the same time are driving toward therapeutic endpoints, and built off of this AI algorithm, we identified some really fantastic multimodal therapeutic targets looking at the shared phenotypes between certain pathologies in this group. And we're launching clinical trials for that drug early next year. And I'm very excited that we're going to be able to speed it to market. You know, nothing's fast in the FDA regulatory world.
No.
My hope very much is that this is going to be to market within the next 2 or 3 years because of the expedited pathways we're able to leverage, if only because of the absolute need for this drug, given so little that has been offered to this population for so long.
Yeah, that's amazing. It really, just listening to you talk about this, and this isn't the first time we've had a conversation, so I know how passionate that you are with this, and it's just, you can feel that coming from you. You know, you can feel not just the passion in the building, but to make a difference. And I think that's what makes you so different in this space, because it's not just like, hey, I have the ability to build something, so I'm just going to go put it together and like walk away from it. You've been with it every single step of the way to say, I've identified this, I want to do something about it, let's get a team together, you know, so you're there every single step of the way to get it to the finish line and then some. And that's just, it's a really cool thing to see that, because when something is built, you don't always get to hear the who, what, where, when, why, how behind it, right? You just see an app, you're like, oh, this has good reviews, let me try it and see if this will help me. But there's something so different about this process that it's not just a idea, build and send, right? Like, you're here with it to really make sure that what you're building is going to make a difference to, even if it's only one person, that one person, it's been able to change something for them in a completely different way than just a run-of-the-mill app or run-of-the-mill program is not necessarily built to do.
Well, thank you. You know, speaking of one person, let me tell you, you know, 25 years ago, I was an EMT in South Jersey, and I peeled my mom off the floor and put her in my ambulance after she had compensations. And then, you know, fast forward 20 some years later, my wife and I, you know, had to band together as her mom suffered many of the same problems that patients in this community suffer. So if it's one patient, so be it. It could be my mom, it could be your mom. But, you know, this is why I'm so grateful to you, Sam. I mean, we've been able to connect, and the community that you lead here is one that is important. It's one that spreads a message that has an important need to be spread, the importance of how many people in our country suffer every day from symptoms like this, and the need to find evidence-based interventions to make them better.
Yeah. And this is a community that I think everybody who's been in this community or diagnosed with gastroparesis, or frankly, just a GI issue at all, has felt so forgotten about, like especially the gastroparesis community, because there hasn't been really much of anything recent. You know, some things are starting to happen now, which is great, you know, that there's more attention to it now, but now the reason that happened is because more people were diagnosed with it, which, you know, you're grateful that there's like a spotlight shining on it now, because maybe somebody out there will give a shit and, you know, maybe want to do some research, right? But you think about the amount of people that had to be diagnosed with it to now get it back in the spotlight. And we've all been sitting here yelling for years, like, we need better treatments, we need better ways to monitor ourselves, we need better medications, we need less invasive treatments, or maybe treatments with less side effects, or, you know, it could go on for forever with something like that. So when you have something that's like, this could be a turning point, right? It might not fix it. It's not going to turn back your diagnosis. It's not going to fix anything. But there's a real chance that by, again, giving some agency back to the patient, frankly, just being believed and listened to as a patient, it increases your positive outcome so much. Just if you have someone in your corner that says, I hear you, I see you, I believe you, and let's see what we can do for you. And you don't always get that, especially as a patient going into the ER. You're not going to get that there. I've had it a couple times, and that's not the norm. And that should be the norm, not the other way around. You know, I've been septic sitting in an ER with somebody asking me if it was anxiety. My body was dying. Like, yes, it was anxiety. 100% it was anxiety. But like,
anxious as well, for sure.
like that's not why I'm here, you know? So to really put that into perspective of this community will be able to have something to help them be believed in a way that makes sense to the patient. It shouldn't have to exist, but the fact that somebody out there said, this is a problem, let's do something about it, hopefully will give it the chance to really make that difference and get to enough patients dealing with this to say, this is what's happening. These are my belly scores. This is all my information. This is what I'm connecting it to. So this is what I need your help with.
Exactly. That's our horizon, and we're very excited to be there pretty soon. We look at where we're going to be in the next few months, and we anticipate we're going to be able to get the digital side of this thing out to patients sooner rather than later. And what's going to be really exciting about it is we're going to be able to get it to patients completely free of charge. They're going to be able to tie into their doctor. The doctor is going to be able to communicate with them securely through the app, everything as protected and HIPAA compliant as can be, of course. And the doctor is going to be able to leverage the same communication abilities that the AI provides to the patient, is going to be able to facilitate the doctor getting that information both real time through the app as well as at your next doctor's appointment, being able to present it, just as you said, as an evidence-based badge of exactly what's going on. Here's my belly score. Here's what the science says. And then on top of that, we're going to allow providers to develop more and more insights, deeper knowledge about what's going on with these patients. And then as we harness all these data points, as we look at really fundamentally performing millions of case reports at the same time, we're going to be able to pull together the lived experience of millions of Americans and tens of millions of more across the globe, and look not only at worldwide influences, regional influences. We're going to look at longitudinal influences, how one thing affects another, and we're going to be able to, for the first time in history, put together the most comprehensive evaluation of what it means to feel this way.
Yeah, it's so cool. Like, to really just look at it from such a holistic point of view, right? Like, it's not just identifying the problem, but it's identifying how it affects the person from top to bottom. And that's just not something that like you talk about very often. It's not something you see very often. So I think this is such an exciting time right now. Like, AI is everywhere. You know, we see it everywhere. We're using it with everything. And like, I scroll on Instagram or Facebook and I get ads all the time for like all these different programs where it's like, use this and manage your health, and use this and manage your health, and put this in here. And it'll, I had something the other day where it was like a dietitian in your pocket where like you're scanning photos of your phone, of your food into your phone and all these things. And I'm just like, it's so overwhelming. And it's really cool. But it is.
It's a dangerous landscape, and
yeah, not wrong.
Just as it's fantastic that these tools give people the ability to create, they give the ability to people to access incredible things. At the same time, it increases the risk of people being exposed to dangerous components of this side of medicine.
Absolutely.
And so, not for nothing, the government is pretty aware that this is going on. And recently, CMS announced a new digital health ecosystem infrastructure that they're going to be pursuing. requirements, if you will, on various components of these apps, and almost to some degree an app store for digital health apps blessed by the Centers for Medicare and Medicaid. And what does that mean? It means that, first off, we're proud to be a part of that. We're proud to have attested and be an integral part of the CMS digital infrastructure. But these apps need to play by the rules. They need to put number one, patient privacy, at the top of the list.
Absolutely.
Knowing that this is so important. This isn't just patient lab work. This is patient experience. These are patient feelings. And I worry that any of these apps that don't necessarily play by the rules become certified software as medical devices. I would worry about those.
Yeah, I know that even just as a person who, is part of a patient community where, people come to us all the time and they're like, oh, can we do something or share this with your patients and all these kinds of things. And I'm like, well, but what do you want from the patients? Like, what are you getting out of them? How is their information protected? How is my information protected? Like, if we have somebody fill out your survey, where's that information going? Are you telling me? Are you telling the patients? Where is that information headed? Is it protected? What is happening here with everything that you're asking patients to do? So I know that as I see these things and I scroll by and I'm like, oh, that looks really too good to be true. That usually keeps me from wanting to see if anything is good. It's like, again, dietitian in your pocket. I'm like, that sounds like a great idea. But I was like, no, I'm okay, or something else. Like, give me all of your information to put it in here. And I know, since we've gotten to know each other, I can say that I would feel safe putting my information in something that you're building because I know that you are putting patients first. I can say that to everybody who will be listening to this episode and say that, I am giving this my stamp of approval. But that might not mean shit to some people, and it might mean a lot to somebody else.
Well, it means a lot to me. We carry some other stamps of approval, if I may. We, of course, we'll highlight again our attestation to the CMS digital health infrastructure. But I can release it here. I haven't announced it yet. We were recently accepted as NVIDIA Inception partners. So we're sort
amazing.
Of really excited to work with the largest company in the world, of course. But understanding that as well as anyone, there have been security violations that absolutely are abhorrent, and we build from the bottom up on an infrastructure as code environment that ensures that everybody's anonymous, randomized, and encrypted.
Now, one thing I know that we had you and I had touched on this with Cora and a little bit more in the app and where that is. Do you want to share a little bit more about Cora?
Cora, it's so weird to have my robot best friend, but Cora is my robot best friend, and she, Cora is evolving, and she'll continue to evolve. When she arrives to you in the next few weeks, she'll be different than what she'll ultimately will be. But Cora really stands as the patient and provider-facing interface for a comprehensive companion digital therapeutic. And what Cora does is talks to you, introduces herself to you, of course, gets some baseline information to understand where you exist in the BellyScore environment, how you match up to others, understanding that the more information that Cora receives, the more nodes she's going to be able to identify to build your machine learning algorithm, what drives your experience. Cora at the same time is going to be able to remember your patterns, to be able to produce and identify patterns within your pathology, to identify, for example, that, hey, I noticed that your belly score has fallen a few points, and this seems to line up when 3 days ago you had soy and yesterday you fought with your sister. These are things we look to harness and patterns we look to identify. And then at the same time, Cora is a critical link to the physician, of course. Cora is going to be able to flag any worrisome patterns. Cora is going to be able to flag any significant drops in the belly score, which should trigger an evaluation by a physician, of course. And Cora is going to allow the physician, to whatever degree the patient allows it, to gain more insight into what's driving a patient's experience. What's really exciting about it, I think, is that we're going to be able to make sure that this is worthwhile for physicians. We're going to be able to make sure that every second they spend doing this pays off for them, both academically as well as financially. We want to make sure that if a patient's insured, the doctor is able to spend their time, and we have to be realists. We work within a little bit of a broken system. So while we're looking to destroy this system, we're going to optimize our functioning within it. And making sure that doctors have an incentive to spend time identifying these patterns alongside the AI, I think is an important part of this. And so while all that's happening, which is to say, Cora's working with you and she'll take any info you give her that I allow her to take. And that can range from anything to, I don't feel good today, to here's what I ate yesterday, to I had my period 3 days ago, to here's a picture of my poop. Let's put it on the Bristol stool classification. All of those things will work together in the front end to help you understand your experience. They'll work together in the middle end to help you and your provider come up with solutions for why you're feeling this way. And they're going to help us in the back end to do what we were talking about earlier, those million case reports at the same time, and continue to identify more diagnostic and therapeutic targets for people.
So you made all of us a best friend too. So she's not just your best friend. You made all of us a best friend too.
I think you're gonna love Cora. I think that she's, I'm so excited to see how she evolves and how she learns. We have to handicap Cora to begin with. There are FDA rules, just as we talked about, right? And we have to. Cora has to crawl before she can walk, before she can run, and it's frustrating because Cora's ready to fly, but we got to follow the rules. So we're going to roll this out in the right way. And what's exciting, at least, is while she may not be able to perform as much as we want her to in the beginning, she's going to be able to collect all the information to just enhance how well she performs when she's allowed to.
Yeah. So from a patient user perspective, going in and putting in my information, is that something where obviously the more information I give, the more that the AI will retain to find patterns, etc. Like that just makes sense, right? So is that something where I would be expected and expecting to put everything? Is this going to be like my one-stop shop for entering my maybe like macros or nutrition, things like that, or integrating something that I'm maybe doing in app A over here to kind of start tying that into everything? Because I know like right now I use probably like 4 different apps, including like my notes app, to keep track of everything. So, and this may be something that's on the horizon, that's not coming out in like, version 1 with everything, but is that something that we could expect now or maybe in the future?
Yeah, I think the answer to all those things is yes and no, and you hit it all, right? So Cora, as much as you give her is as much as she'll be able to process for you. And right out of the gate, she's going to have the ability to receive information not only of your sort of journalistic experience, but also some tools that allow you to more quickly identify these things, including back to the stool pictures. Always, everybody loves the stool. But then that will evolve with time, of course, and a lot of that is tied to what the FDA allows us to do and when they allow us to do it. Of course, that Cora is going to integrate with wearables and people, whether it's your Meta sunglasses or whether it's your Aura ring or something more. We're going to receive that information over time, and we'll also work cross-cutting across the apps in your phone. That being said, this all does again go back to that CMS digital health infrastructure initiative, which is really pointed and targeted at making sure everybody talks to everybody using what's called FHIR messaging and allowing these sort of similar language across computers.
Yeah. So with the physician usage of the app, like I'm using it, I find it really helpful, and I want my doctor to use it. Like, is there, as a physician, how would maybe you want somebody to, or your patient to say, I'm using this, this is something that you could have access to or you could use to help me, especially if this does all the things that you're telling me that it does, and I believe that it will, and I find it really helpful. But in order for me to get the most bang for my buck on utilizing this, I need my physician to either have access to it or be willing to try it and use it too. How would you maybe suggest to patients to approach that conversation with their physicians?
Well, I think I very much hope that very few patients have to have that conversation with their physician.
True,
Of course, yeah, but we're hopeful that this is going to be more of a top-down approach. That our relationships that we've already forged with the insurers will lead to the physicians. That the insurers will see the value that this brings to everybody involved in the care cycle, deliver this to the physicians as part of their agreement and understanding with the physicians. That being said, any physician unaware of what we can bring to them, we're going to have a dedicated team to make sure that we're able to pull this together. But what the patient can relay to the provider is that right now you're giving me nothing. Right? When I come in and I have a complaint and I don't feel good, you're giving me nothing. And this is the same conversation that I have with doctors in the emergency department. Right now, you got nothing for this group of individuals. And so the next step here is this validated clinical therapeutic for patients, which not only is a benefit for the patient, but then you're able to sort of layer in this concept that this is something that we built not only with patients in mind, but it was built by clinicians with clinicians in mind. I've had, I don't know how many millions of patients over the years, and understanding how to synthesize them into the system is just as important as wanting to synthesize them into the system. And so we do, of course, allow providers to link this directly into their electronic health record to not replace, but simply add on to the amount of information and ability they can offer their patients.
Yeah, I think that's probably one of my favorite pieces of this so far, is the addition to the health record, especially when I go into my records afterwards, and it's like, oh, your physician added notes, after your appointment, and I go down and read and I'm like, that's not correct. That's a wrong diagnosis. That's not what I said, but I can understand how you got there, to kind of go down where I'm like, there are things in there that not intentionally maybe misrepresent the situation, but it's just shit happens, right? Things go quickly. Maybe I have hypoparathyroidism. I can't tell you how many times I've seen hyperparathyroidism in my chart over the other one. I'm like, but that's a big problem. If you're trying to treat the wrong thing, you're going to do the absolute opposite of what I need you to do, right? So having that as a supplement to the record where the patient has the control to add to that, to show that in there, and we joke about poop on here, and I know you made a joke about, uploading your photos, but also you can do that. That's one of those things where that's very helpful. That's actually very helpful to have that in there for compare and contrast, or any other things that you want to upload in there to be like, no, this is what I told you, or this is what I wanted you to see. This is what I wanted added into my record. And the doctor has access to what the patient wants them to have access to. They don't need to see their journalistic notes of everything that happened for the day that they've added or told Cora to put into the app, right? But if they want it, they can say, here, have access to that. This makes it easier, so I don't have to repeat myself over and over and over again. Now you have access to the same pattern and seeing the same pattern that I've been telling you is a pattern for a very long time now. It's irrefutable evidence that you're able to provide. Now, whether or not they take that into account, that's on the doctor, but at least you're getting the most, assistance. You're coming into that more prepared, with more, evidence and everything for yourself to advocate for yourself, to get the help that you really shouldn't have to advocate for, but that's the world that we're living in. So let's give people the most, access and ability to do that for themselves.
So, the crush that primary care doctors are under is they see patients every 10 to 15 minutes. And Sam, I'm an emergency doctor. I see patients every 10 to 15 seconds. And
Yeah.
so we can understand that everybody's certainly trying to do the best, hopefully. But what's fantastic about Cora is where your doctor gets 10 minutes, Cora has the ability to synthesize weeks of experience into seconds and to
Yeah.
provide that information when it's needed, where it's needed, and how it's needed. And to for the first time to harness the ability of these emerging technologies to make things better, not just for rare molecules and things that affect a small slice of the population, and not just to affect commercial economic viability for another small slice of the population. For the first time, we're really harnessing this technology to provide cross-cutting benefit, to really be a rising tide lifts all ships kind of thing.
Yeah. No, it's just such a cool concept, and I think that, as more comes out and patients are starting to follow along and seeing this and really being able to see the step by step of, access to this and to really see what it can do and realize that you don't need 7 different apps to and your notes and this and that to kind of put it all together. You can have it in one place. And I think, like you mentioned, the wearables earlier, and like I love my Aura Ring. I have had an Aura Ring for probably 4-ish years now, and this thing it knows when I'm not feeling well, like before I'm not feeling well. And I don't usually take stock in a lot of the numbers, but the patterns that I have learned, the things that I have seen in all of the years that I've picked up on that have given me more insight to myself. Like, there's data overload everywhere. Like, I've got a Garmin, I've got my Aura Ring, we all like wearables, we all like data, but it can be really overwhelming, especially adding in all the new capabilities with AI. It's like just data overload all the time. But when I realized that there was, if you kind of cut out the noise and really just focused on the patterns of the things that you want to pay attention to, like my sleep, my heart rate, my HRV, those markers, and kind of cut out all the other unnecessary noise, all of a sudden I started being able to identify things that I hadn't been able to identify before, or that I wouldn't have picked up on if I hadn't have been paying close attention to those patterns. So I think having access to this newer technology to add on to the ability that we already have to track things and to collect that data is just going to, maybe it's the missing puzzle piece that I've been looking for. I actually said that earlier today in a doctor's office where I'm like, I feel like there's been something missing for years that I don't fault anybody. Maybe they just didn't know what rock to pick up to find the missing piece underneath it. They didn't know what pattern to look for, so they didn't know how to find it. I think about, could this help me eventually identify that thing that in my gut, even though I know it's broken and I shouldn't listen to it because it's broken, but in my gut, there's something telling me that there's this piece missing. Maybe this could finally help me lead to that pattern to find that answer, and the more that idea is in mind, the more we think about that from the patient experience and pulling in how you felt that day. Like you mentioned before, like you had a fight with somebody, you ate soy, you had this, maybe the bariatric pressure was different that day. All of a sudden, all of these things are pulled together in one place, and you're like, here's a pattern that you never had access to identify before. And that is a huge leap in patient access and to believability for what you're going through, because now you're not just drawing straws to say, this is how I felt, and I know that I felt this like a couple Saturdays ago, and maybe there was like 2 other days, and I think it connected to when I was outside, and it was like, you don't have to do any of that anymore. It does it for you, making it easier for me to hopefully take care of myself, but also get the help that I need.
Yeah,
that was a long tangent. Sorry.
No, I love the way you put it. There's a signal to noise ratio problem to be addressed here. When I was a little kid, my parents gave me this CB radio for Christmas. Santa brought it. And you could go to any, this is back, you're too young for this, but you could go to these different channels and you could talk to truckers. And there was this dial called the squelch
Mm-hmm.
dial. And if it was up too high, you would lose all the signal because you were just trying to suppress all the noise. And if it was down too low, it would be all noise because you were getting too much signal. And the point is very clear that everybody's got a different setting on the squelch dial. And
Mm-hmm.
allowing using AI to dial in to the right signal to noise ratio for you, the right
Mm-hmm.
frequency, is very important. And to have this technology now and to partner with you, to partner with G-PACT, to partner with individuals who are on the wrong frequency, to help them dial back in, I'm very honored to do that.
Yeah, and we are so grateful. I'm so grateful that you randomly emailed me that one day, where I'm just like, who is this guy and what is this is he talking about?
I'm
So
getting old,
thank you
Sam.
for doing that, and for joining our medical board and really just helping launch, us and patient care and, physician care more into the future, but with everybody's care at heart. That's really been, you, like I said earlier, you can see it, you can feel it, as we've gotten to follow along with this journey. And I'm just really excited when patients actually can have access to this, because I think they're really going to see all the hard work that you've put into it and also how cool it is. And they're just going to love Cora. So we all need a best friend, right? So why not Cora?
Wonderful. Well, Sam, thank you. Truly, I can't wait for all that's to come. And it's been a slog. We've been working on, but we're getting so close to the first of many end zones here.
Mhm.
And as we all march together to make everybody feel better, I really value the partnership.
Yeah, us too. And I'll make sure to put all the information, how to find, information on the app and, where to sign up for the wait list and everything in the caption so people can follow along on the journey. And just thank you so much for everything.
All right, Sam. Thanks. I appreciate it. I guess I'll talk to you soon.
Yeah.
All right. See ya.